So I'm Dr. Amer. I'm from the University Malaya Center for Addiction Sciences. I'm actually the coordinator for the Nicotine Addiction Research Group. We have had the recent Global Adult Tobacco Survey, which actually shows that our startup age for smoking is about 12 years old. But as they smoke the cigarettes, they become addicted to it. They start developing symptoms which are consistent with addiction. Things like compulsive use, they have to have that cigarette. Withdrawal symptoms, when they don't have the cigarette, they start developing physical symptoms like cold sweats. Some of them might have blood pressure changes. They might have some emotional responses, feeling irritable. So these are withdrawal symptoms that they actually get, and these are the main core symptoms of addiction. You've got the unaided treatment or the unaided way of quitting, which is often called cold turkey. What we do know is that if it's an unaided method of quitting, your success rate is much lower than an aided method of quitting. Often we say that if you decide to quit smoking, try to find a quit date within 2 weeks of the time that you've decided to quit smoking. And that's because studies have shown that if you decide within 2 weeks, your success of actually doing or actually quitting is actually much higher. If you're smoking 20 cigarettes a day, this would be a good time to actually start reducing the number of cigarettes, aiming for that quit date in 2 weeks' time. So you could do something like 20, 18, 16, 14, maybe let one cigarette linger for a few days because it might be difficult for you to let go, and we understand that. If you are one of those that are not too addicted to cigarette smoking, and you could do a simple assessment on your own, you've got to be very truthful to yourself about this. You ask yourself, how soon after you wake up do you smoke your first cigarette? If to yourself you answer almost immediately, that means you wake up, the first thing you need to find is a cigarette, then probably you're highly addicted. Doing it on your own might not be the best thing to do. So I think one of the best ways is actually to engage with your friends who actually don't smoke. For that meantime, just to give yourself that strength to be around people without having a cigarette. In Malaysia, we're quite lucky. The Ministry of Health has actually got 300 quit clinics available for you to actually use. The difficulty is actually finding them. But when you actually find them, you've actually got somebody that you could actually discuss these problems and decide with you, not for you, decide with you about whether you'd like to go for more individual type of counselling, or maybe they might have some group form of counselling available, or they might do counselling and treatment together. We've got two types of treatments that have been proven to be safe, effective to actually quit smoking. One is what we call the nicotine replacement therapy. It's where we give this treatment to actually assist in managing the withdrawal symptoms I've mentioned before. And they come in various forms and shapes and sizes. You've got patches, lozenges, you've got gums, and that just is, it's just sort of whichever suits your fancy, if that's the way. The other method that has been also proven to be quite effective is the non-nicotine replacement therapies such as varenicline or bupropion. These are tablet forms of treatments. These require you to seek doctor approval and prescription, and probably an assessment prior to starting them.